Welcome to my presentation. My name is Newton Gichaba. The presentation focuses on using evidence-based practice to improve patient care across all our healthcare systems. The goal is to leverage innovative informatics tools to provide staff with practical, accessible learning opportunities to enhance their skills and knowledge. By standardizing clinical decision making through these tools, we can reduce variability in care and improve patient safety. The education plan supports staff professional development, equipment, nurses and other healthcare providers to apply research-backed guidelines effectively in their daily practice. Overall, this initiative strengthens competence, promotes best practice, and ensures high quality outcomes. Evidence-based practice positively influences the quality of patient care by ensuring that latest research supports clinical decisions. Nurses and providers can utilize EBP, specific informatics tools to assess up-to-date guidelines. Clinical research and standardized protocols quickly and reliably. Such assess minimizes the chances of making errors, which are often the results of working with outdated knowledge or individual judgments. It facilitates uniform decision making among providers, which reduces care variation. Through evidence-based healthcare practice, patients enjoy safer care, quicker recovery, and enhanced confidence in healthcare system. The learning objectives for this education are designed to be specific, measurable, achievable, and directly connected to improving patient outcomes. The initial goal is to ensure that staff can access and use EBP tools with confidence and in clinical decision making. The second objective is to reinforce the use of critical thinking and decision making abilities through the incorporation of evidence into practice. The other goal is to enhance the general competence of informatics, ensuring that staff feel at ease when working with technologies and platforms, with an emphasis on utilizing standardized evidence-based protocols, which aim to reduce variability in care and enhance safety. The instructional methods for this education plan will use blended learning, combining e-learning modules with interactive tools to keep staff engaged. The virtual simulations will enable learners to apply evidence-based practice in real-life setting and enhance the decision-making capabilities in a safe environment. Mobile tools will allow the personnel to access EBP resources at the point of care with ease. The clinical scenario powered by AI will offer adaptive learning with content tailored to learners' strengths and their needs. The joint debates will promote cooperation and mutual problem-solving making. Overall, these tools facilitate active learning, enabling contributions to improve patient outcomes. This education plan is contingent upon available resources. The informatics and IT team will assist the technical skills to introduce AI and simulation tools. Employees will need to use mobile devices such as tablets, smartphones to access learning resources at the point of care. Online libraries and databases will facilitate evidence-based practice, and leadership support will ensure both funding and organizing backing. The technical support is intended to be continuous, enabling prompt problem solving. Concisely, these resources will ensure an effortless implementation process and staff confidence in learning process. The timeline for this plan begins in 1 month with planning and preparing educational tools. In month 2, a pilot test will be carried out with small group to identify potential issues. Month 3 will focus on the staff training to ensure everyone will be comfortable with the technology by 4 months. By 4 and 5, the full rollout will begin all departments in month six outcome data and staff feedback will be collected. Finally, in month seven, results will be analyzed and improvements will be made to strengthen the program. Recruitment for the educational sessions will focus on engaging staff through multiple channels. Nurses will be informed about the detail of the stations through announcement during in the staff meetings and through newsletters. Flyers in break rooms will have a daily presence. The hospital's intranet and email reminders will support the creation of awareness and ensure that no personnel are left behind. Peer-to-peer support will also promote enrollment, particularly when the peers emphasize how the sessions can directly benefit patient care. All in all, the approach of integrating various means of communication will guarantee increased participation and buy into the program. A contingency plan will ensure the program continues despite unexpected challenges. Online sessions will be offered as alternative if in-person training cannot take place. Backup facilitators will be ready in case of scheduling conflicts. Recorded modules will be available so staff who miss sessions can still participate. If technical issues arise, a support hotline will assist learners promptly. Training times can be extended if workloads or emergencies interfere with participation. Feedback from staff will help identify barriers, allowing quick adjustments in the program effective. The success of this education plan will be assessed through multiple strategies. Knowledge acquired and skills will be enhanced, will be measured by pre and post training. The tracking of completion will be undertaken to make sure that the staff participation is achieved. The utilization of evidence-based practice tools in clinical environment by staff will be observed and audited to identify the effectiveness of staff. The staff feedback survey will provide us with understanding of the usability and satisfaction with the learning tools. Lastly, the practical result will be measured against the actual effects on the patient outcomes. These findings will guide the further development of the program for use in subsequent sessions and help improve continuity. Using informatic tools to support evidence-based practice enhances outcomes by providing staff with reliable access to current guidelines and research. Writing creativity in learning, including in interactive modules and virtual simulations, reinforces staff capabilities and confidence, while also enhancing uniformity of clinical practices to minimize mistakes. Prompting lifelong learning is a way of keeping nurses up to date with the changing best practices. The informatics teams, educators, and staff will work closely together to ensure that the program success. Regular reviews enables the education plan to be updated, ensuring it's effective and focused to the patient objectives. Thank you very much.